hopeful for the future. Because of you, there is light at the end of the tunnel. We don't have enough words to express our gratitude for your sacrifices. We can only acknowledge it and say thank you. National Health Mission, Government of Meghalaya.
Good evening, everyone. We welcome you to this live program powered by NHM, Government of Meghalaya. We have in our studio a team of experts from the Health and Family Welfare Department, Government of Meghalaya. This evening discussion is the concluding episode of the series COVID-19 Pandemic, Paving the Way to Recovery. In the past 1.5 years, COVID-19 has continued relentlessly, and in our state, as in other parts of the world, there have been periods of surge followed by a relative lull. In Meghalaya, we have experienced two distinct peaks, with a sharp peak recently in the month of May 2021, where East Khasi Hills has bore the brunt of more than 10,000 cases. Today's discussion will focus on practical prevention and control of COVID-19 in public and workplace, and what have we learned from the second wave to avoid the third wave. We are happy that we have with us a panel of experts today. I would like to introduce you to Dr. Amanwar, who is the Director of Health Services, MI, Government of Meghalaya. Welcome, sir. Dr. Valerie Lalu, Specialist, Directorate of Health Services, MCH and FW. We welcome you, Dr. Valerie. Dr. Alka Flora Marak, Medical Specialist, Ganesh Das Hospital, Shillong. Dr. Robert Marak, District Surveillance Officer, East Khasi Hills. We welcome both of you to this program. Hosting the session today, I am Dr. Shibulet Kongla, District MCH Officer and District Immunization Officer, East Khasi Hills District. And I'm hosting this program on behalf of NHM. Kublai Pi Baro, Sashisien ni Priang Subhai Pi, Shakani ka program, Banya Merjing Mut Halor Kapang, Kumno, but ke A kabang in le, Hadien kani ka kala kabaar, Jong kani ka klam, Kobit kat kandai. Kani ka klam, kalakta, ia ka jingim jong baro kinong shong shnong ka jela, but hakari India, but ka pertehi. Hatu, ginhaban mat, ia ka kala kabalai, tu kanya ngap, kidon ayam ki doctors ki bangala penithu mentan, kidon ban ong ha kani ya kani ka pang. Hakani ka program ngin yakren da kaktien pareng, ngin kren da kaktien khasi, but ngin kren ru da kaktien garu. Hakaba sedang ngadon ke jingkeli na kabenta jong i director i jongi i Dr. Amanwar. Sir, the pandemic affected all of us in one way or another. So it is inevitable that COVID-19 will be on our minds for the foreseeable future. The impact on livelihood, mental health, loss of health and loss of lives, loss of school year, loss of jobs, loss of job prospects will probably take years to assess. As one of the decision makers and the leader of the team of COVID warriors, sir, can you kindly brief our audience on the measures that were taken to fight the pandemic so far? Sir, kani ka klam kalakta yang ihapon kirukam. Lah ka kam ka jam, ha ka pulia ka puthi, ka jing pang ka jing shitom, ka jing do, jong ki ba iit ki ba thon ki jong i. Kumunong penyat ya kani ka department, nani ka tanat jong ka kwat ka kia. Belong unong ai but, unong ai lenti. So bahaya thot lam yang i kendian, ilat ki ba ka department kalashim. banyak kon yang ni kaklam nado basdang hado menta meneh.
Thank you, Dr. Shibalat. Very good evening to you and all the panelists present here, and of course the members of the public who are watching this program. The measures which we have undertaken all these months for the past 1.5 years now, more than 1.5 years. I think our state in that way had been it has been very effective, and the protocols which we had brought out from time to time, that has played a big role in containing. But see, all set and done, we still have a lot to learn from this pandemic, which is still very much active. Now, in the past 1.5 months, we had the cooperation of all the stakeholders, from the government right to the village authorities to the Rangbashnongs, and we have our frontline workers from the top right up to the Asha level and the Anganwadi level. And they have played a significant role, each in their own responsibilities entrusted to them. And because of the roles played by all concerned, including members of the public, to a large extent, Meghalaya has been one of the states which have contained well this pandemic. And I would like to add here that the help given to us from all quarters, the departments, the district authorities, the government as a whole, the NGOs, they have played their roles. And if I have to name each one, it'll take a lot of time. So these were the things which had given us the hope that whatever comes, we will be able to contain, without forgetting that at the very top level, we have these review meetings every week, sometimes 3-4 times in a week, to review and to take decision at the highest level. These are the decisions which have given us that confidence. And the roles played by the Rangbashnongs, the Shnongs, and the members of the public, despite discouragement and resentment from some quarters, we were able to reach where we are now. Para panelists ki badan lang pangiang ni, para doktor jengi ki badan lang hang ni, kumjuru ki bapet ya kani program. Nashko taman ong gawai ba kay ka bangila ban le hadu manta. Ho ngibun ki bayo yaw ni knyang jingpang kibun ki belong positive. But ki donru ki ba shtamjur but ki ba khladno. Hendrai kay ka ba nakaliang ka sarkar, nakaliang jong isnong, nakaliang jong ki nong 3 months ho ba, kumju ki department jong sarkar ba pher ki nong 3 jong ka kot ka khya nadu na jong shatu ki Anganwadi kini da ka jinge 3 ringkat lang bat ki pad nong snong kawanra ya kata kajing la jongka jela ka jungi bante lakam katukan ni na ka jing saphyang jong ni kujang jingpang bat kani kala pelat ingiru na ka jing sosi kibobun kibala banja kumalong syakiwei pat kejela na kwa ban chuban hang ni bak jing trai sitam jong baro kelum lang kanum laban jer UAPWay nadu na jerong chadu shapo kini kidei ki aka kiba pelong bangin la bani khun yagani ka khlam klet ba kirai kiba ngishim nadu na jerong ba shim nadu na jerong do jong ki bor sarkar kiba kendu hagini ki meeting ki bangi laban rai teng teng sisin sitio teng teng sausan sin sitio du lada don kam kini ki ayengi ya kata kacing slur baki aymen siemingi bangin la bantrai khamba banyada ya ki pahat nam song snong jungi nagani khlam obre shibon.
Thank you, sir. Sir, I would like to ask you one more question. Life after these two waves, how do you perceive it?
See, what happened is that we have experienced when the pandemic hit us in 2020, and towards the end of 2020, we realized that we have to live with this virus, and we had mentioned at that point of time the new normal. And we have insisted, and we have time and again stressed on the COVID appropriate behavior. We had stressed on the SOPs. We had stressed on the 3 cardinal instructions given by the government from time to time. In the month, till the month of February 2021, we were doing very well. But due to the coming in of the mutant virus, we had another peak which hit us very badly in the month of May 2021. And along June, July, August, September, we did our best. The government provided the best. Although we had a substantial number of cases who had passed away due to COVID, compared to the rest of the country, we have done very well. Plus, now with the coming down of the cases now, the first thing which comes to our mind is complacency. And this is something which will be detrimental to us. We have to learn that to contain this particular virus in 2020, we had a problem. We had only the treatment which is called symptomatic treatment. Beginning of 2021, we had the vaccine. And we have seen how the vaccine has helped and has worked wonders among the citizens of the state. And I will reiterate again once more here. The people who have been vaccinated vis-a-vis with the people who have not been vaccinated. The doctors in all the hospitals treating the COVID cases will stand by what I say, that the suffering suffered by the patients who were not vaccinated was unthinkable. It was not even bearable to watch them go through that pain. We have the vaccine now. We have done everything in our capacity to motivate the people that don't label this as bad, which is something good. Anong nakasi ngidon ya kani ke injection ka chungi ke vaccination ka bungi ong pat kani ke babhatam what pen snew ya kani ke babha mentang ngila dep ai ya kita ki instructions ke chungi barkhot iwei pai wei inong song snong kitip menta chpang covid-19 kitip kumno bala banya dai ledi kasyong stang hanga kasyong stang hafi balada ngikwa ban im pat kumbajulong hakipor shabanwan kani ka klam ni bot perking yagini kijing patha jong sarkar but anda ngila nang but ngila sotho panle kini ke hangta kansawan kataki sngi kiba nia kermen kisngi kiba uni uknyang dimpang unum yo ban penjot ban penpra ya kibriu kijongi ya kajat benriu kijongi kubleshwa
Kubleshibun ni pisa. Ngako aban ong ya ki ba pet ya kanika program balada pidon kinu kinu ki jingkili subhaban tho po kitu ki comment box ki badon hang po Facebook. I want to ask our viewers that lines are open. If you have any query, kindly drop your query on the comment box. Thank you. I have a question for you, Dr. Valerie Lalu, and welcome you again to this program. As what Sir had said just now, there were COVID appropriate behavior protocols that had been in place for a very long time. And we have seen from the very beginning that when the COVID-19 pandemic was looming upon us, these stringent measures were already in place. Yet we could not stop the disease from reaching our country or our state. Do you think that changing people's attitude is a tough battle then? Dr. Valerie, kumba I sir ila ong mantan la hikai shibon ila aiki awareness lingba shibon ki media lingba ka jingarap jong ki shnong ki thau baro the administration hakbang ila hikai bhai ki brio kita ki ban pertu bot kita ki covid appropriate behavior. Hari kajing kelipat kalong kumni ba what happening kita kita ki kendon ki bala penjari ru ni knyang udang wan hi ban telep ya kari ke jongi ba ya ke jela ke jongi kajing keli ka bang adon ban keli phi kalong hato kalong ni em ka ba ban pen kala ya ka jinglong ne ka jing milin ki pat ba hakato ka por. Dr. Valerie.
Thank you, Dr. Kongla, and good evening to all the panelists and also to all the viewers of this program. Yes, Dr. Kongla, you have mentioned about the COVID appropriate behaviors that we have been asked to follow. Meghalaya, in the beginning, being a remote state, people were a bit, they were thinking that the virus will not reach us, but eventually it did. And this virus, it can be transmitted only through humans, so it is based on human behavior that the transmission of the virus is it goes, either it increases or decreases based on the human behavior. So we all know about COVID appropriate behaviors, but very few people are very they follow them very strictly. Even now, if you go around in market areas or in any crowded places, you still see that people hardly wear masks, and then there is no social distancing, and I don't know if sanitizing of hands are being done enough. So If we look into the first wave and the second wave, we should really learn from history, right? How the second wave has increased, and how many deaths we have had, and how many cases we have had. So we have to learn from the past, and we have to improve on the situations that may happen in future. So again, this all depends on human behavior. So if our attitudes are right, if we continue maintaining COVID appropriate behaviors, I am sure we will not be able to face the third wave. But as you have said, changing the human behavior and human attitude is very tough. It's very challenging, in spite of people knowing about the way the virus is transmitted and how to prevent it. Still many are reluctant to follow COVID appropriate behaviors, and especially now that we have the vaccine, still many people are reluctant to take the vaccine. So yes, we have had a lot of challenges based on human behavior. And I think this is the biggest challenge that we are facing as of now. Kumba Pilaong, Dr. Shibulan, nadu kabanengkong hapo Meghalaya ngi klem poi perkhat ba ngin yo kanika klam mo namar bangi mut bet ba ka Meghalaya kalong ka state ka ba long syakendong hendre ngi yo hi kanika klam ngi ka wan hangi ka walen shop hangi ki bun ki briu ki yo ya kanika klam bat ki ba du ya ka jing im ka jong ki du ki bun hoat ha ka banengkong ngi tip ya kini ki COVID appropriate behavior lani ki rukom bangin kiar ya kanika jing pang COVID lengba ka jing deng ya ki mas ka jing ya jengai iwe na iwe bat ka jing ya le khot ya ki kti ki jongi nei henrei bun sien minta pindalet sha ki jaka kum ki yo lani what hapo shalong lani shabar jung ka shalong ru kinyo iba bun ki briu ki tresho bandeng ki mas nang ta bakin penjenga iwe ni iwe kani kalong ka jinglong mo jong ki briu ka ba e haban pen kala wat la ki tip ba mo kani kadi ka jingpang ka ba ma bat ka ba kabala ban ya datang da ka ba deng ki mas bat da ka ba ya jenga iwe bat ru mentale la don sa uni u vaccine lani utika henry ki bun ki briu ki badang don ka jing artatien ka jing tieng haki but wat langi na kaliang ka health department ngilaya le stom ngilale jur kumnu ban pen sapriang ka jing tip syapang ni u virus batru na syapang kini ki rukom ban kiar batru syapang uni utika henry ki ban pen kelaya ka jing long jung ki briu kalong ka ba e bha bat kani kalong shisha ka ding pen kiang yangi ha ka jing yele persya ya uni uknyang blishpun
Kubleshipun Dr. Valerie, kuma pilakran mentan, hoi, ngiri man pertua buat kita ki COVID appropriate behavior, hendrai menta pade hakanika sien nadu pasdang kasnem nila iyo saya ketika yada na COVID kat kendai. Pila doktor ban bapai kendiat syapang kani ketika?
Hoat kani ketika ngila yo nadu ngizdang ban ai kipat ba nadu kan riu tarik jong January jong ni u ar hajar ar powai dia kabang yo niutika bang yo hapo Meghalaya udai u Covishield u balashna daka Serum Institute of India dia uni u Covishield udai bangin yo ardos ma lani arkala shidos pin ai nang tap dia hadian khatar hadu hapedeng arko khatar bat khan riu tayo pin yo ya ka second dose ma lani u inject u baar nang tapat ya uni utika ngi ai hapo ki brio ki ba khat plasnem shalor ma ki ba hapo khat plasnem ngin pat ai menta shen ngi kermen bangin yo hi uni utika u ba hapo ki khat plasnem hendrei haduk menta khat plasnem shaneng bar ro salon sar ngi ai uni utika dia ki jaka ai inject ru ngi bu haman laki PHC ki CHC ki sub center bat ru hakishnong ki thau ki ba ki briu ki la ban let ban shim dia haduk menta uni utika uyarap na kumba prapo haduk khandai po persen uyarap ban yada nakanika jingpang banong ban hadu banda poi hospital lani jingpang jur mo batru nakajing yam bun ki brio ki mut ba da yo tika kamut ba ngim yo shu ya ka yo ni u virus hendrei kalong ka ba kabam dei hoat pila ban yo virus hendrei kajing pang ka ba kaban len shop ya pi kan long ka ba kanamdon kata ka ba hadu kajing pang hadu ba pinda poi hospital lani ba pin poi shadu ka temir jong kajing yap lani hadu kajing yap ru dia namar ba POE menta ki buan bah ki brio ki ba poi hospital men hakini ki por bakar sedang ka second wave lele POE buan ba kim yo jakathia ha po hospital ru adu ba ki brio ki don kam ye ki oxygen ru nei hendrei da ka ba yo ni u vaccine kini ki baro ki brio ki light ken nakajing ta jong ni u virus.
Thank you, Dr. Valerie. I have a question to Dr. Robert Marak, who is also the District Surveillance Officer of East Khasi Hills. Doctor, can you tell us how many people in Meghalaya were infected with COVID-19 in 2021? And what are the statistics this year? And kindly explain in Khasi also, Doctor. Doctor, we cannot hear you. Can you unmute yourself?
Yes. Hello.
Okay, now we can hear you.
Yes,
Yes,
good
you can
evening,
go ahead,
ma'am.
Doctor.
And
Yes, good
good
evening.
evening to all the panelists as well as all the viewers. Now, if we look at the data of the first wave and the second wave, we can see that in the first wave, we had about 14,065 cases and about 150 deaths. Whereas in this second wave, now we have about 69,494 cases and 1,299 deaths. If you look at the proportion, 83% of the cases in this of the total cases we have had in this second wave, and of the total number of deaths, 90% of the total deaths we have had in this second wave. The case fatality has also increased from 1% in the first wave to about 2% in this second wave. Now, if we look at the positivity rate in the last 7 days, we can see that the positivity rate has reduced a lot, and it has come to about 2% in the last 7 days. But if we see and if we look at the data, in the second wave, we have had many cases as well as many deaths. It's because of the new variant, the Delta variant, which we call it. And we know that the Delta variant is not only highly infectious, but also highly transmissible. That is why we really need to follow all the precautions given out by the government, and also take care of all the measures, not only the short-term measures, but also the long-term measure, which is vaccination. Dengan keren daga Khasi Indian, ladang ipet yaki cases haka first wave, ngiyo kumba khatsaw hajan ripo san ngot kibayo COVID haka first wave, but kumba shispa san pongot kibriyo kibala klat nakaniga COVID, nakaniga jingpang COVID. But hakaniga second wave pade kumban ripo khandai hajar sauspa khandai po saungot kibriyo kilayo COVID, but kibala klat kilong kumba shi hajar arspa khandai po khandai ngot. Te kajingkiyo jong kanika jingpang COVID hakanika second wave, but ru kajing klat jong kibriyo hakanika second wave, kadai nakadaw jong kanika Delta variant, ka variant jong kanika klam COVID kabangiyo manta, but kanika variant, Delta variant, kalong highly transmissible, kalaban sapriang kamsted, no way ubriw, siya way pat. Kum haka first wave, lada way ubriw yo COVID, ula ban pensapriang siya ki laingot. Tang bahaka niga second wave pade lada way uyo yau ne ujing pang COVID ula ban pensapriang syaki kumban reungut ki breu pada bat kita ki hin reungut saya ki we pada ki la ban pensapriang bat karukam yada kade tang naka bangi follow ni budin yaki protocols ka baka sarkar kala ai om tangi ki short term measures handrai laki yaka long term measures hukum jo but ka long term measures kade tangka vaccination kumanta.
Dr. Robert. I have a question to Dr. Alka Marak. Doctor, by now a good number of population are really aware that people with comorbid conditions are more vulnerable, to COVID-19 infection. And the severity of the disease is also more prominent in such individuals. Yet, at times, we are really exasperated, especially as caregivers, as doctors, by the denial of the disease and the hesitancy in getting vaccinated and following the COVID appropriate behavior. Doctor, what do you think are the reasons and how can we address this forward? Another question also I would like to ask you is, as a medical specialist in Ganesh Das Hospital, are pregnant women more vulnerable to getting COVID-19? I also request you to kindly talk in Garo also, just a gist of what has been going on. Doctor, kindly unmute yourself. Thank
Good
you.
evening, everyone. Thank you, Dr. Kongla, for the question. In response to your question, people with comorbidities are, as we all know, more susceptible to the infection because they have lower immunities. People with cardiovascular diseases, chest conditions, blood conditions, younger children with poor immunity, premature children, also some people with kidney conditions. These are more vulnerable to getting this COVID-19 disease as we know it. However, these are the population who are more apprehensive, who are more worried about taking the vaccine. For those people, I would like to reassure them this vaccine is completely safe for all groups of people, especially those with comorbidities. Kindly get yourselves vaccinated. I can understand the apprehension because you feel, why, I'm already sick, I'm already weak. Can I take this vaccine? Will this vaccine be detrimental to my health? Will it help me or rather cause more problems for me? So far, the people we've vaccinated, many of them, in fact, more than 90% of them have not experienced any adverse effects. The adverse effects which are associated with vaccination are usually those associated with any kind of vaccines, be it fever, body ache, some sort of rashes, but those are completely manageable by the current treatments that we have. So I would like to request them, if you have any apprehensions, if you have any worries, anything about getting vaccinated, kindly do contact us. We are there in every hospital. Talk to your specialist, talk to your family doctors, or even call us on our numbers. We are here to help you. We'll be more than happy to help you, to guide you through this vaccination process and how this vaccine helps everyone, especially those with comorbidities and who are having low immunity, and how much helpful this will be for you all. Ni soing pa mandirang na nga akan sunas kanya dashi chini dal parang ni akan ang pa nga garochi alam lat hanatken. Ang 2020 niya COVID-19 sabi siya ko nagpainjok 2021 ba nakang ko ingat at anjing bijang chiyo nakang jacham may na anjing behavior COVID behavior ang ko chakalang hacham anjing lockdown ko gis nangi mani hacham aru je kon government anjing na skiang hacham warang ko anjing namin jar king hacham inda ka chi anjing ni COVID 2020 o COVID-19 o ang pa sabi si control ong na matangjok up to February March takarang na anjing cases bang nagjajok hindi ba. 2021 no anjing nagtal variant isa sok pajok ko na anjing delta variant ni mga delta variant tara ya gacham ka pa COVID virus ni mutation ba black patong khat pa jok black patong khat pa ani yung jok ya virus ni jeni asel anjing batter kakani ko patro nukchok aro mandi ko bulgaria tani aro siya no sokatani pang ako nukchok anjing kang ba 2020 yung ka pa COVID-19 ara saksa mandio ni sakini mandio na batna kapachim Hindi ba dao gni pa wewong kat kepada saksa mandi onin saktok mandi na patri kerkat na mana arwa saktok mandi aro wa dakin barir kerkat na mana yarang ko anching maina chagrung jok skang pa anching haida skang bo wevo bang in kang jani sel alamla complacency bawa sense of complacency dong jok ong agen shungai jok anchi dakna nangani rang da de mat bari de choba gruk chohani anching chanchi mat jok ni man haida anching ni simsa kanirang komyangi yung naba dongin jok aro yani sel anching patri kengani ko nukjok 2021 no anching na 2021 16 January uni vaccination ba cheng jok chem yang ko bang amandirangan ra khusyo ra chak chem indi ba mata mandirang kisua ya vaccine ko ra ang nakhinan yung gen ma namgi jan yung gen ma ang na namgini ko ra bagin ma mabatte sa ang na namgi jan ko bang ni be na bigriat ni ko ra bagin ba in ba dao depe dan chini vaccination aba cheng oni dao na mamung kita adverse effects pa belonge side effect ongani ko magkujenga aru nekang jawa hindi man especially je mangan sabi sirang dongso achim je rangan sa dongso achim je ka diabetes je ka hypertension ba kidney ni problem nunggo parang ba heart ni problem nunggo parang ba stroke ngi sai dong parang ba bisa rang je rangan premature ngi achim ba ukdang pa mandirang wamang na ya vaccine longin nang chungota anjena vaccine ba cheng metungo pregnant ladies bas uknang parang na dongjachim ini ba tawa anjing sokari anjing Meghalaya sokari yako encourage kainga ba uknang parang na ba pregnant ladies rang na ba anjing yako ningjo maina anga saksa ganesh taso medical specialist ong kam khabaingon anga uknang parang ni bang nge nikani nikka ko chakung ang kangjo ko mang ni sisok pija donga ko mang ni bisarang ni sakna ko bang inekjok aro yarangon jumping na kita vaccination nang chungot ko po nga aro dakchak chungot ta je mangan aching vaccination matjok chimjin vaccination ra jok chung wamang ni sarang belongja alam mala sudi gusyu matna getak ke gusue rang si soki alam lan salini sagatam dongi man namang playa ba je mangan vaccine ko ra kujachem wamang di belonge sauna soka aro rasung griya odisya na basuka ini man anga yako na simang na skiya achingya government of Meghalaya ni meetings rang programs rang especially a COVID na program wat parang aching maiko mat na ka dong ya aching ni population ya aching mandis karang ni healthy ong edaw ako ya COVID-19 sabi siya ni chelchak ke ba safe ong edaw ako nang dikiya unig man ya meeting rang ko ating ya program rang ko ating na simang na yako ma-shut na kita je mana ya COVID-19 beta namgijak ba sabi siya ari ako anching may dakat something na matgen COVID-19 ko anching COVID appropriate behavior jakalachi yang short term remedy aro vaccination ja long term remedy yako jakalanchi anching ni jakman ja uli jangi thani rangko je ka anching khango jangi thang jong ko pandemic nas khang wadakin anching jangi thang na mat kugen indi ba anching pandemic ni jakman di normal lokni jangi thang na de alamala khadongani normal mani dis khang geta dakit jangi thang na geta de anching expect khana de mat khujana bagnang indi ba anching COVID appropriate behavior jakhala social distancing jakhala saksa sakaban chekre ki takim na vaccination jakhala ore jakshujrung na aro mask ko namme jakhalinga ong ode rong chu na namagta within the guidelines jakhala ong ode yara anching dakchakani chong mutken in response to your second question ma'am as a medical specialist in Ganesh Das, I have seen many pregnant ladies with so much discomfort, so much problems, so much seriousness of the illness, ma'am, as you said, as opposed to those people who have not been vaccinated. Yes, they are vulnerable. They are vulnerable because they already have low immunity. They are already having anemia. They're having so many because pregnancy itself is a immune compromised state. So they are vulnerable to the infection, and they are vulnerable to the most serious form of the illness of the condition. So since our government has approved vaccination for these pregnant ladies, I would request everyone, especially the pregnant ladies, to kindly go get yourselves vaccinated because it is imperative that this vaccine is given to you before you become pregnant or while you're pregnant, so that it saves you from the serious illness, from the severity of the disease. If you were to visit one of the hospitals in the isolation wards, I'm sure all of you would agree, but Since you cannot visit and you don't know the gravity of the situation, take it from us, the experts who are visiting these patients every single day. Kindly go get yourself vaccinated and kindly follow COVID appropriate behavior, all the 3 cardinal COVID appropriate behavior like washing your hands, social distancing, especially masks. Proper use of masks, not below the nose, not below the chin, covering your nose up to your chin, proper seal, and if you're not wearing an N95 mask, at least 2 masks, one surgical mask and a cloth mask, and that too a clean one, which you change every now and then. Thank you, ma'am.
Thank you so much, Dr. Alka. Dr. Alka ni ibatai kumno bagi ni ki ba armet ki don ki bakloi ben yo ya kani ka jingpang bat ha ki pang ki yut yo kem yo COVID khat khandai ka jingpang ru kalong ba jur nga kumabat ya kani ka district MCH officer ha ka district ki jongi la ban ong ba la palat khan riung mut ki long kmi ki la do e ka jing im na ka daw jong COVID bat na ka daw ni khat ye pi baro ki long kmi so ha wat bu ri ha ba ki don ka jing jir kho ka jing shit ani ka no ka jingpang ha par pi armet one shiki health center one but what shep tieng but shimru ya ketika kaban ya dai pi na COVID khat khandai. We will have a short break now and we will come back for the next session and we will go through the email questions that have come to us. Before that, I would like to remind our viewers that we have this behavior change management app, and then you can always download this app from the Play Store, and there are information that are available in Khasi, Garo, and English language. And then you can get information about vaccination, testing centers, COVID-19 beds that are available in the hospital, ICU beds, the home-based management, and so many more. So do not put off, downloading this app, because it is an app that will help each and everyone. So we go for a short break and we will come back. Thank you.
Nak kamay mtasi.
Kam biang phi.
Belayu. Pi so diao ba.
Kadao ko lang ba ngampat sim ketika ya dah COVID-19 te. Kadao ki brio ki sngo atapien te ban ki taksi jonga.
Dia boleh pa family chimi ta injek eta.
Kata ken kwa tamba sngo klumar jemut. Banle ko online ter bas ko lang bangamdan te ko phone ko biang bandan ni internet.
Hentip sa. Bagi sarkar kalau sedang menaitika kelanda dan kamban bukupa. Pisulai bed sedang tuang tu penyoy ka.
Syasa?
Ha, pisulai bed akan kuno ke cakap.
Government of Meghalaya.
Ade bachi na sa dali dengtang manche hari angya.
Oi dan India soni dat batsrang ba tika ko shuani bakra phana nakyang ade.
Na de tika ko suna kin pajama de.
Mana se ken pagno tika shu jo sanga kena nang bata.
Endi ba ye tika ni gimende manderang de rokum riktagan binga de.
Manderang de phangnan ji jakuba aga nagin.
Dako dia tika ran aljo kanig nang ma.
Oi ye tika ko shuon nak na chasa person aljo kani ko gen ye de unjaba. Endi ba covid sabisi ko matno ba nak ni be ani ngo ye sabisi ko blaki na awara chakna gtaman gno. Aro jangina mahamun ken chakani dongjawa ha.
Ayo ade ye tika shuani jak mende manderang beljummi sa tukingan ya kan tuknya de.
Tika suanci sanuba be eno dengas na arus kusanirang dong nawa genang. Endi ba tika suan jamano yerang de ong be walsa tantangan na magin.
Dako dia tika ran aljo kanig nang ma.
Owe iya ko gisgrabo sana bananyo nami wi masigparangan ya tika ko rachakaha. Doktorang, engineerang, politicianrang, zaurato dakmesokubarang aro songsarni ba manderangan ya tika ko suna gta ba seira tokaha.
Ayaw ade abanak mga tika suna jak rpai no.
Manderangni skathang agan jojonirangko aro tholle gepat khoborangko na akna thnabe. Tika suani shomai sokon na tika ko shuera bo.
National Health Mission, Government of Meghalaya.
Mahmood! Hey, Mahmood! Where are you? You gotta be careful.
Why are you shouting?
Aren't we supposed to go for COVID-19 vaccination today?
Oh, just a sec. I will get ready.
Stop! You're not ready as yet.
Now, what happened?
As per the government's new safety measures, you should be wearing a double mask in order to fight against the new variant of COVID-19.
Double mask?
Yes, a double mask. A surgical mask and a cloth mask on top of it.
Okay, let me get one quickly. Okay, now I'm all set to fight back this COVID-19.
That's right, my warrior friend. Let's reclaim our lives. And remember, you don't need to wear a double mask if you're wearing an N95 mask.
National Health Mission, Government of Meghalaya.
Sien yi wan biang po studio, but yen yakran mentai ki jingli ki ba one link ba ki email. I will ask the first question to our DHS, and these will be very short and small answered questions because we are having only a few minutes more. So the lockdown is eased. Many schools are going to reopen now from the 1st of November. The pandemic is in a lull, and the wave may rise anytime. People do, sir, to avoid a surge and a probable third wave.
Thank you. See, what happened is now we have given the instructions. Cases are coming down. Situation looks like it is improving, but don't take it otherwise. We have to always remember, we have got the vaccine, vaccinate. We have got the 3 cardinal instructions: double mask now, hand washing, and social distancing. We know about this. We have to get ourselves vaccinated for those who are eligible for vaccination. For those who are not eligible, we are very hopeful that that vaccine is going to come out soon, and we will be able to vaccinate our children, especially so between 12 to 18 years. Now, from where the infection will come? The infection will come from those who have not been vaccinated. And where will it spread? If we get a virus which is going to affect the young ones, remember, it is my responsibility, it is your responsibility, that we should see to it that we are not the ones, the adults, who will spread the infection to the young ones. We have to open our school. We have to get on with life. We have seen how many people have suffered. We know the sufferings which they have gone through. We would never like that the same sufferings, we should go through the same sufferings again. Lockdown is a no-no right now. What we want is that a new normal life. And for this, don't forget the instructions. We are going every day. Our health workers are going every day. All the stakeholders are educating, are giving awareness, are providing information through so many mediums. Please remember, cases may improve now. Situation may improve now. But we have to be prepared for any eventuality. And for that, the COVID appropriate behavior instructions, protocols are a must for each and every citizen of the state. Para lok baro, menta pinpet ba hot kadon kajingkeman bat ngikirmen ru namar ba kini kikis mentah kilastang banduna ha hendrai ngidai ban sutu ba kani kaklam kampat kut kadang don but kandai yang bat yafi bangin yada yaki khelung kena kai ke bangidon ban yada mentah kadai ketika dari ke vaccination ke bengyong nimdan kam ban ya dibiet chu spang kani ngilai i ngaladep ong meneru ba kitu ibakeren persya spang ketika nan cia tu tanggo wabun kilong yeng kilong sem siteng mit siteng senya kisit phone ini namar bagi sitom ki bahaya nginda keli filadep ai nem ke vaccination ni lampat ai na poisha hospital kadno ka jing sitom ka jongki ngilai i kata ngilatip ngimdan kam shu banetai nya spangani kino ki bakren persya ya ke vaksin penpet kindai ki briu ki bamdei ki doktor ki bamdei na ka medical line ki ba syukran raha syukran tang namar baki i ki na social media lane kisno bakani ke vaccination kadai ka bawan na ka sarkar te kamot kadai ka pamlong ladang ngi ai ganu ke advice halor ke kuat ke kia baru sikata him jupet chuan na ki social media man pet kadai ne kam de balai ya gani ke barang dei ke khlam ke bala ban kata ke bala ban saphriang kloi ni dang bo jingkeli lightly ki jing tha ki bengla ai kata double mask kamot atsentap ka mas menta ban penjngai we ni we ban thet ki ti ban le khot kita ki ba penlong ini bangin la ban yata kin sedang no ki school nilai i ki jing bagi kendo ki pat nilai i ki jing jung ki kena bagi do i ki school bangin yo biang ya kani ka jing im ka batmai ka bangin ya lang ba khlam so ba bot ya ki jing batha so ba wat nom nget ya kito ki bam nget kubleshwa
Kubleshipun sa ngakuan keli Dr. Robert kawai gajing keli ba kumno ngi pensisya ba kani ka khlam ka khamduna la ni ka yo athia hatu ki hospital bat ki ICU kila ki dap ne ki duna ma ki thia pang pila ban batai khindiat pangani Dr. Robert
Yes, ma'am. Lada ngipej manta kumba ongi sir DHS jongi. Ki case kila nang duna but haki hospitals ru lada ngipej ki nong thia pang kila kham duna haki government hospitals tangba haki private hospitals kidang don hi kumba khat pra percent na ki na ka capacity jong ka hospital kadang dap dakini ki nong pang covid ti kumbai ongi DHS menne kila duna ki case tangba ngimpat deban kensting namar ladang ipej haduk menta kibala yo vaksin ru kidang de tang kumba sanpulai percent na kibalong eligible ban yo ega vaksin kidang yo ni u vaksin but lada pipej kibayo yo u knyang jingpang covid ru na ka population baro ka we tang kumba R% na ka population kidang yo ya kanega knyang jingpang ti kumba 40% na ka population kidang de kibadang long susceptible but kibala ban yo ni uknyang jingpang hakano ru kapor ti kumanta ngitip ba ngidon haka stage 3 jong ka pandemic kata kamot ba kala don ka community spread uknyang ulada don haman la ka pakawai ka jaka ti takadaw ngimdei ban kensting ngidei ban bot lut yaki kendon kiba kala bu ka sarkar deng bha yaki mask tap bha nadu khmut hadu ktin thet bha yagi kti khamtam shuaban kta yaga dur khmat lajong bat smubha ya ai ya kanega tika kaban yada yangi ladangi yo ni uknyang jingpang covid namar ladang iyo ni utika kanyada yang i naka banjur ka jingpang ladang iyo ni covid lani nakabangin poi siya ka hospital ladang iyo ni jingpang kumbanta kumbang laong ila adon haka community spread ti ngimtip syu mano bala ban ra ya gani ka jingpang but nangno ngila ban bid ni jingpang ya katangi ka community spread but ladang ipek du bon kumbah 100% nakibayo ni uknyang covid kimpen iya gidak kishin ti kata kadaw long kalong kabak kongsan yang i baladangi peni kano kadak kishin ngidai ban tes yalade namar ngimtip uni u virus u covid virus udai u opportunistic virus ngiyong ma lada ka bor yada jong ka met jongi ka duna kumenta bakala sapriang gani ka jingpang ngila uno breuru ula banyo ya uni u knyang jingpang but bon nakibayo ya ka jingpang kimpen iya gidak kishin ti kumbalaong ki doktor menero ki wegi doktor hapo hospital kumbenta kidai tang kitu kibadan kano ka jet jingpang hakamet kibakam jur ka jingpang lada kiyo ya uni u knyang covid but ladang ipet na kibaklat ru kumba prapo khandai percent na kibaklat kidai kibampat yo what single dose ru jong kaneka vaccine ti kumbang ui ba ka jingpang kala nang duna bad hakini ki news ngi ka jingyap ru kamdan na uni uklam tang bang empat day ban kensting namar ba 4% jong ka population jongi kadang long vulnerable.
Kumlishipon, Dr. Robert. Dr. Valerie, in many districts and even here in Shillong agglomeration, the vaccination coverage is very good. In fact, in most cases, it's 70 to 80%. So do you think there is a decline of cases in these areas? Do you agree with this? And the second question is, what are the challenges that the state immunization, officer or the office, let's say, put it that way, face in rolling out the COVID vaccination? As you have already said that COVID vaccine is not protective 100%, but yes, it will protect 80 to 90% from severity of the disease. So kindly tell us, what are these challenges that we face in rolling out the vaccination, and whether you agree or not that in these districts where vaccination coverage is good, there is a decline in COVID cases.
Okay, thank you, Dr. Kongla. Yes, I would definitely say there is a correlation between vaccinated districts, and the severity of infection, or I would say the load of infection in those districts. So the districts where if you see the districts which are performing very well, in fact, who are more than 70% of the citizens of those districts are vaccinated, such as Southwest Garo Hills and East Jaintia Hills. If you see now, the load of cases there are very less. But if you look towards the other side, like West Khasi Hills and West Jaintia Hills, now West Khasi Hills, the percentage of vaccination is only about 40% of the total eligible beneficiaries, and even in West Jaintia Hills it is around only 46% of the eligible beneficiaries. And in the past 1 month, the case load is high in these two districts. Of course, East Khasi Hills, we are seeing a rise mainly because the population is more compared to other districts. But if you see those districts which are, they have not stopped having cases, such as West Khasi and West Jaintia. They're having more cases now, and also deaths are happening every day from these two districts. So definitely there is a correlation between vaccination and the load of infection. So I would definitely would like to ask all the people of these districts especially to get themselves vaccinated. And as you were mentioning about the challenges that the state immunization cell is, or the whole immunization machinery of the state, I would say, is facing, is the hesitancy of the people. Now, hesitancy, if you will see, the main cause of hesitancy among the people is not that they do not know about the vaccine. Many people know about the vaccine. But the problem is that many are in denial of this virus. Many people think there is no COVID-19 virus. Even if they get infected, they do not want to get tested. Though they know that it is a COVID infection, they do not want to test, and they do not want to acknowledge the fact that they have got that they have got infected with COVID-19. So I don't know, maybe the reason is fear or embarrassment or that stigma, but people definitely do not want to say that they have got COVID-19, and because of this they do not want to get the vaccine also. So and again, another thing is that yes, we, from as you know, Dr. Robert has also mentioned, and sir has also mentioned, that we have done many activities to create awareness among the people, in right to the village level. Our medical officers and the health staff are relentlessly going to the people and telling them about the benefits of vaccination. But the people are only willing to listen to hearsay and to these false messages, and they do not want to listen to the benefits of vaccination. So I feel that that is one problem that we face, the challenges that we face. And another challenge that we are facing now is that many people who have received the first dose are not coming for the second dose. People should be aware that just receiving the first dose doesn't give you 100%. I mean, at least the optimum protection of 80 to 90%. You get only 30% protection. You're still vulnerable to infection. It is only after you get 2 doses of the vaccine that you are fully protected. So we need to really make the people aware that 2 doses of vaccine is only the means to get out of this pandemic. As Dr. Robert has said that we majority of our population, only 30%, 34% of our population are fully vaccinated. That means around 50% more are we need to get vaccinated to get that herd immunity. That means that if some of those vulnerable population get this disease, it will sure spread to everybody, because we are leaving room for the disease to spread. So there is sure chance of a third wave if our 50% of the people are not vaccinated, and then, and as you know, appropriate behaviors are not being followed. So we have to be ready for a third wave if our if 50% of the population, another 50% are not vaccinated. So kani ka khubor ya baro ki bapet ya kani ka program ru ba kumbang ilatip ka jing ka challenge leni mo ka jing ka bangi ni syam ha ka jing ai tika ka jongi hapo ka state kalong ba bun ki brio ki jongi kim kwa ban nget ba kadon kata ka klam covid ba uta uknyang jing pang ba udon menta watla teng ki don haki ka jing pang ki sngo thu ka jing stom la jong bakala bandai na covid-19 henry kim kwa ban let ban test pat nalor kata kim kwa bakin banyo ka vaccine ru but they lengba ki brio kum kita ba ni u knyang jingpang uyu alat ban sap khyang ha ka imlang ka sa alang ka jongi lada khandai pau percent ki brio kim shim ya u vaccine kamut ni ai la ya uni knyang bo un sap khyang shushu ha ka nika ka imlang ka sa alang jongi but wat lang yu I baka kies kanang hiar kala benlong ba uni uknyang jingpang udang kela namar uknyang ru ulong u hap hi ban im ndai u yale kat bala ban im hakanika leng hapo ki brio nei telada u I ba ki brio ki dangdon ki ba dang pli ka jingkhang it ka jongki longkup unong tu bo ula ban wat lat nangnu ban rung uknyang ru ulong kum tala da I ki brio ki ba dang duna ka jing yada hakabormet ka jongki kimdan kataka kita ki antibodies laniki shipai yada mo hakamet ka jongki lengba ka vaksin kamut uta uknyang unrung biang bat lada ula keladur lelei kan long ka bajenjar ringi bangin pen tem ya uni ya kanika klam mo kanika pandemic na kata kadau ngidi ban smooth ba ngimdi ban shim tang shidos ngidi ban shim ar dos uni vaksin tang da ka bashim shidos ngimdi bangin snow bangila smusngan mo bangila shim tika henre ngidi ban shim baro artlikidos English one.
So, thank you, Dr. Valerie. I have a question to Dr. Alka. We'll just continue with English and we'll wrap up in Khasi and maybe a little of Garo later. Dr. Alka, I would like to get your opinion on post-COVID syndrome. And also one question, do you think that this pandemic will have an impact on the health-seeking behavior of our people, especially the chronic diseases? Dr. Alka?
Yeah, post-COVID syndrome is essentially a continuation of your COVID. If you have had any kind of COVID, not just severe, even the mild asymptomatic ones, those who had never experienced any symptoms while they were having the disease, later on they might go on to experience symptoms like extreme fatigue, tiredness which continues for maybe 2-3 months, anosmia, loss of smell, loss of taste, which may continue for 4 to 6 weeks, up to 3 months. Then those who have undergone intubation and who have survived that intubation, they go on to relive that stress, giving rise to post-traumatic stress disorder, sleep disorders, anxiety, depression, from having to go through all that the person has gone through while suffering from COVID. And some long-term conditions like lung fibrosis, lung diseases, unable to breathe properly, palpitations, some kidney problems which might persist for longer periods of time, and anxiety more often, and then some skin problems. That if you're already a person with comorbid condition, your symptoms may get aggravated in the next time you fall ill. So, person with comorbidities, yes, they may experience all the symptoms and more. Especially, it's more of this tiredness, this fatigue, this loss of taste, loss of smell, and a little trigger might cause the person to go into more serious illness. Some heart conditions like myocarditis, lung conditions. You may be more predisposed to respiratory tract infections. Yeah, and then. Like I said, people, for fear of being detected as suffering from COVID-19, like Dr. Valerie said, because of the stigma associated with it, or because of the embarrassment, or just in plain denial that the person can have COVID-19, a person that COVID-19 is a reality, is a disease which is actually spreading, which is actually here and spreading among our population. People who are in pure denial, yes. Such kind of people do not come forward for testing up until the last stage, when they are unable to breathe, they're unable to maintain their oxygen level, they're unable to control their fever, where they become unconscious, where they come in a state where we are in a position of not being able to help them, because we try our best, we give them our best possible treatment, best possible management. However, if the person has crossed a certain stage, we as doctors also are incapable of helping them. If you come at the right time, if you come at the right place at the right time, yes, we're able to help you and we're able to guide you through your recovery. But if you come at a stage where we are unable to help you, then yeah, like I said, we become helpless. And to your second question, ma'am, regarding health-seeking behavior, yes, I've seen the past few months that people uh, do not come forward, be it for plain symptoms, be it for their old diseases. I have had patients who've come after 6-7 months because they are unable, they are unable to control the symptoms anymore. They're like, actually, I had to come 6 months back for my treatment, but because of this COVID, they'll tell me I have COVID. They'll do the rat test. They'll poke the swab under inside my nose, and it'll be painful and all that. Yes, health-seeking behavior has diminished a lot because of this disease. But I request you, I ask you to come forward, and please come forward and come for your vaccinations, come for your regular checkups, come for your follow-ups, especially those with comorbid conditions. Uh, please do not hesitate to come to the hospital. We do not mandate testing for everyone. Only those who have the symptoms, who require it. For those, it is inevitable. We have to do it. But if you do not come forward for your treatments, you don't come forward for your vaccinations, we are also unable to help you. We want to help you as much as possible. And this being a medical pandemic, medical situation, we would like to help you as much as possible. We are here to help you. But if you do not come forward, with your health seeking behavior, we are helpless. Our hands are tied. So I would like to request, especially those with comorbidities, kindly do not hesitate to come visit us in the hospitals. We will do our level best to help you. And please, those who are eligible, I will reiterate this again and again, those eligible, those with comorbidities, please come forward for both your doses, not just one dose, like Dr. Valerie has said, like Dr. Robert has already told us the statistics. Do not come forward only for your first dose. If you've taken your first dose, I agree you have protection, but only 30 to 40%. Please come forward for your second dose so that you are safe from the severe form of the disease. All of us have cold and cough. All of us have flu every now and then. But those do not bother us because they go away on their own. COVID will be like that only if you have taken your shots, both the shots at the required time intervals. Please, I request you, I reiterate this again and again. Only 50 to 60% of our population are vaccinated, like already highlighted. We need more people to come forward to get your first doses as well as your second doses. Do not hesitate. Come forward to us. We are here to help you. Ni so yung parang nakanati nga, actually population ni so punga percent so tok percent rangsan vaccination ko man nga. First dose ba second dose. Our second dose na diyung parang bari bak hujay nga. Awa man ko mulat na skiya ka sapay. Nasimang ni second dose ko raibo na asimang yung COVID-19 ni champing ni bulko. Ba antibodies na ko mat na taskin mo de at least 2 doses. 2 doses are essential. The dose gani ko na nang chong muta. Kang pa dose ni jakmano anti-chi gani banti chi dok ni isip pa ching ya vaccine ko na nga na chong muta. Je maan sabi chi dong so dongwa chim je man kidney ni, heart ni, lungs ni, brain ni sabi chi nang dongwa chim mamang ka sa pai pam na tani first second dose ko raichi na gato mola tinga anchungo ni may takpa mandira ngoni ya COVID-19 spread ok naman na je maangan ya vaccination ko man kujenga wa ma ngoni anchung ya habishi ko man na kraa aro anchungo ni je man vaccinate ok jenga may takpa mandirang matgin bisharang anchung bishar bisi chichet komi pa bisharang de ta na ba vaccine anchung na approve on ko jari ba jokchum in ba government di approve on ko ni na anchung ni bisharang na anchung ni chandamerang na anchung simsaksona anchung ang tantong vaccinate ka na je dakpa dia sabichi saksa mandini na bachawa aro na simang na champegan niko badakchakan niko aro ya sabichi ni najokan niko ona matgen je mangan sabichi dongsuenga chim morang ka sa pa ay antang tangko check up kana follow up kana ba somo ya kana ta kita check up na riba pun na kita jad kinabe riba ba hospital na gemuk ko jinga test ka aja je mangkon nang chung muta je rangan symptoms to mang ko sa test ka aya na si mang ni pressure na heart na katoni sabi sina check up na ibag parang kasapay judging pa na be kin pa na be hospital na so ni treatment ko na tiba naman gen na si mang yan san mo latani treatment ko ra China vaccination ko ra China aro COVID appropriate behavior je kai mask kana jakshua aro saksasakpan chit thang kito nga yarang ka jarik na nang chungmuta yako da sini ya kana nga anchini experts kamakan anchini ya gemuk ni mamang ko ba anchini isikra pajang chimo ba ya vaccination ko anchini isikra na nga aro COVID appropriate behavior anchini isikra nang chungmuta. Thank you.
Thank you so much, Dr. Alka. We have a question that has come in the comments from Facebook. This is a question from AF Rigsai. His question is, what about the importance of proper general public masking? Can somebody answer that? Dr. Valerie, what about the importance of proper general public masking?
I think we have been reiterating about that again and again. We have had banners, hoardings all around the state to reiterate the fact that masking, that also double masking, is important in prevention of COVID-19 disease. Yes. Even in public places, we have many district authorities have again and again send out notifications that in public places there should be masking and things like that. So I think the public as a whole, majority of them are aware about masking. But the problem now is, as I have mentioned earlier, is that there is complacency right now among the public, and that many are not wearing masks anymore because they think that since cases are decreasing, so there's no need to wear mask. But they should remember that this behavior itself is going to feed the virus, right? Because us not wearing masks anymore is going to be an opportunity for the virus to spread the disease through us. So that awareness is surely going to benefit the public as a whole.
Thank you, Dr. Valerie. We will take short messages from every one of you, but we will start first with our DHS, Dr. Amanwar.
Okay,
So your
thank
last
you.
word.
Thank you. See, my last remark is this. Now, COVID-19 is here to stay. Khlam COVID lani ukyang jingpang COVID undan bet batngi hasilinter kijingim unkala it will change, but now is the time to understand. Mentaka da de kapor ba fin soto. Ownership of COVID-19 is you and me. We have to take ownership of that. Ngedai ban long try mangi ya gani gajingpang. But habang long try, when we own this, means we have to take care of ourselves. And by taking care of ourselves, ladangi sumar yeki kiba ngila ban prevent yakani kajingpang. If we take care so that we prevent this pandemic from going on, from taking over our lives, that sense of ownership has to be there. You can't expect that other people or the government only or the shnong will take care. If each and every individual takes care of themselves, so that iway nong shnong isumari dalade ngets kem ba pat ngadon na kata ka jingkermen pat ke ki mengiji ong hi barbor ublay track and rat udon lang batni. A loving God is always with us. We can protect, we can prevent, and we can do away with this pandemic. Kublai Shibon, thank you.
Thank you so much, sir. Kublai Shibon. I ask Dr. Alka, your last word, please.
My last words would be please realize this COVID-19 is here. It's among us. It's a reality. We need to live with it because as we all know, another lockdown is not a possibility. We need to learn to live with it. We need to know how to keep ourselves protected, keep our children protected, keep our family protected, and that is through vaccination and COVID appropriate behavior. Nisong pa sa kantina na yako sa nahanap na skay nga COVID-19 ang sinigisip po dunga yako ang sinigisak tigal naman siya. Ang sinigisip po dunga ang tangni manderang ko ang tangni ni manderang ko ang tangni bisharang ko ang sinukni dagparang ko ang sinibuchma budi parang ko ang may taki simsakso na nanggen may taki ang wamang ko ya sabisuni daljo kira kinaman gen. Warang ko ang takna katananggen ayarang ko ang vaccination chi batika shu anichi. Pungbini kon shu anichi. Aru COVID appropriate behavior je kai mask proper mask kanani jakshwe rongtalan ni ko sakhalani aru sakpun chithang ke dongani aru nangja depet nang telja depet anchung khatjana gata anchung yako nangchong muta aru yanagre anchung salantini jangi thangani anchung je kai anchung treatment ana nanging anchung morang ko anchung kan ni khana nanggen je mangan sabisiran dongeng anchung morang riba china treatment kura china 칭하나 심망고 dakchakna donga je hospital chiba je clinic chiba 칭하 donga nangana diri ba pabu aro chingko grunge pabu. Thank you.
Thank you. Dr. Robert, your last word.
Yes. So, as everyone has said, COVID-19 is still here and is still to remain with us. So, we need not be scared of stigma or anything. This disease is like any other disease. And as I have said, that since 65% of the those who got infected, they don't show any symptoms. Those who have symptoms, they need to come forward and get themselves tested. Any type of symptoms, because as I said, it's an opportunistic virus. You don't know, you may be just having diarrhea, dysentery, body ache, fever, flu like symptoms. Come forward and get yourself tested. Only then can we contact trace the others who might have come in contact with you if you are a carrier of the virus. If you don't come forward and get yourself tested if you have symptoms, we will not be able to detect others who are not showing symptoms and who might be transmitting the virus to some of your loved ones. We have lost many of our loved ones because uh, contact tracing had not been done properly. Those who were positive never mentioned the names of whom they have come in contact with. That is the main reason. And as more than 40% of the population are still vulnerable, and the eligible group for vaccination of the total population is only about 60%, I request everyone, all who are eligible above 18 years of age, to come forward, get yourselves vaccinated if you love your family members and your community. Thank you.
Thank you, Dr. Robert. Dr. Valerie?
Yes, I would like to say that let us not allow COVID-19, to rule our lives. Let us learn from history. We have had the experience of eradicating smallpox. We have had the history of controlling polio. So we together we can surely uh, do away with this pandemic. We can do away with COVID-19. So that will only happen if we all work together, and we all get together and vaccinate each and everyone. If you yourself have got vaccinated, ensure that your family members who are eligible for vaccination get vaccinated. Ensure that your loved ones, your friends, your neighbors get vaccinated, and that also not only with one dose but with both the doses of COVID-19 vaccine. So my only message is, please let us together eradicate COVID-19 disease as we have done with smallpox and other diseases. This is not a difficulty for us. We can do this only if we work together. Let us not fight each other. Let us not spread fake news and try and confuse each other. Let us help each other, and let us fight against this disease, not against each other. Thank you.
Thank you so much. Well said. I thank our DHS, Dr. Amanwar. I thank Dr. Valerie, Dr. Alka, Dr. Robert, and we thank NHM also for this program. Kumban kren penkut ya kan ni ka program nakaliang jong ka health department ni kwa ya phi be phin so thu baka kwat ka khia kam dei tang naka health department ni tang ni ki doctor ni ki nurse ni ki frontline workers henry ka dei ka jinga trei si tom lang jong baro ka bakum bagi la yo I ban isa la ong mene ka jong ki faith leaders kata ni ki rang ba nyam ki ba pher nang ta ki rang ba shnong the district administration but ki wei dei ka ba kong santam ka dei ba mangi hi shimet ni dei ban ki clear ya ka jong ka jingkot ka jingkhia ka jingkot ka jingkhia ka wan tang la dang in la ban ya dai la di na ka jing yo tiam ya ka jingpang ni la I shibun ki jingkeli ka ba ya dei ba ka jing deng mas kwa ban ong ye phi ba phi mi shabar na mar nyim la bangin maintain ya kata ka henriu phut kadang kami ngi bangin deng bahaya kamas kumbala batai doktor menne bangin deng bah na duk khbut ngin tap haduk katemo nyim dei ban khenkai kata ba kongsan ka dei bah bangi shem ya kan ketika idon ke jingkit clear na ka bentai la dia idon ke jingkit clear na ka benta ka yeng ka sem na benta ki khon ki kti ki jongi bat na ka benta jong ka imlang ka salang baro ho ni nem khmi lenti bakan wan ka kala ka balai la ni kata ka third wave jong covid khat khandai hendring in le kata tang la dang is ngotho bangi don kam bangin ya treilang ladang yim ya treilang kamut nila rem lupa akhat sobhai pi baro to ya treilang bat ni bangin yo yaka jela ka jongi ka bakwat ke bakia. Thank you everyone, thank you viewers, we wish you a blessed weekend. Thank you so much. Kublai shibun.
Kublai atu pitep bayu knyang jupang covid khat khandai la ban pindu jan da manga bat mapi hoi ringkat lang nila alai banga ngan puni kumno haguno no gupor ba pijur ho ni senria kunma berbor ba pidai bandai la ka chintur daga jan rumal kat bala yele ban perkhingil dia ban kta ila ki khman ka khmut bat ila ka chintur saj bhai ila ki jongi kti daga sabon kumba arpho second aa pinjangai iwe ni iwe bat dakin mau ban yeng jangai kumba nruput aa kabakong san aa kadai ban dengi ki mas man la kapor kawi ka surgical mask bat kawi ka mas jan nalor lada pidan kano ga jimpang kum ka jirho kishit pinhiar thaitman kapor shitom ban ring man siam do kabor jingman bat kabor jingsma phone cheki health center ki bidan hajan jongpi lani pila ban call yau ni toll free number iwe sao iwe not namta kinogino ki jingirau yarau ingi bangin yarau ipi
National Health Mission, Government of Meghalaya.
Ôi nặng pa Ngadi am jing juk mi jalanin bi enan dak plan sing jinga aro bi en ban dak planning inga
mai nga
ngadi bi en ding skinga aro suldi gu shuman ninga angko check up ka en yu namkin kun
te chala ina ba check up kana nangama yara bil시한텐 쇼르디 구슈데 동치마야 봐 와치 카리 속조고데 check up kana nang자마자 ninna mangaige
나디 야 갔다 고아간 안 살가 탐 플랭 족대 아유 아디 내 인족 주시네 있구나
어이 낭마 여야 미치게 마야 옹족 어이 낭마 어이 매워
낭마 안구도 호스피탈 오나마이 놓고 아디 암쟁조 그거도 엉나 산이 남발도 나빠동아 사브리브리 사지로
바로
왕이 뵙고
Hello? Angi dak wala kada nasma dak panabe. Narani gusuode, bend ngode, o kriode, ningokode, swe, thoa thogi jako masi jaude. Gengthung mamung bibako manjaude. Rangsan antangko sakkebanoni cheli dongatbo. Aro covid chiskuko test kainibo. Nokko dongo maiba. Rokomgini dakwa maxko ganrongbo.
National Health Mission, Government of Meghalaya.